This is my favorite recommendation to give people that have chronic low back pain, hip tension, all sorts of other dysfunctions of the low back, lumbar, spine. And really what it comes down to, a lot of times we feel because there's tension we have to stretch something, but often that tension is there because there's weakness and those muscles are trying to compensate for something else. So a really big deal is activating the deep core and activating the glute muscles. And that's gonna help that low back have the stability and the length for it to feel really good. So this is the pelvic tilt, pelvic lift sequential. We're gonna lay on our back. We're gonna have our knees bent. And the first part is as we breathe out, the belly button comes in. Second part is as that belly button comes in, our pelvis tucks underneath us and we feel our low back flatten into the floor. So we're gonna breathe in together. Belly button comes in. We tuck the tailbone and push the low back into the floor. 2, 3, 4, relax. So when we relax, we unroll that tailbone and we have space between our low back and the floor. We breathe into that. Again, breathing out, belly button comes in. We tuck down into the floor, 2, 3, 4, 5, and then we relax and we breathe in. Good. So now that's just learning how to activate the glutes and activate the deep core and turn those muscles on. Now, we don't want to actually have our pelvis tucked all the time. That's actually gonna load our lumbar disc. We just wanna be able to find the muscles. We're using it to find the muscles. So really what we want to do is we want to do a micro tuck. We want to do a little tuck and make space for that L5 and L4 part of the low back. So again, we breathe in, breathe out, belly button comes in like we're squeezing our waistline in, and we do a micro tuck and just push those first 2 lumbar vertebrae down, L5 and L4. 2, 3, 4, relax. Good. And we tuck just a little bit, and we can maybe put our hand underneath that L5 area. It's just above that triangle bone that is the sacrum. So we have that small of our back. There's your L5, there's your L4, just above that big base of the sacrum, right at our waistline, where our pant waistline is, okay? So this is the area that we should feel flattening into the floor when we do that micropelvic tilt. Now, the last part of the sequential is combining all of that with the pelvic lift. So we're gonna breathe in, breathing out, belly button comes in, micro tuck, and then we squeeze those pelvis, those glutes up, and we're holding that micro tuck, and we're stretching that lumbar spine, we're stretching those femurs across, away from us. We have a nice, straight core and spine. Our shoulders are back. Our head is lightly pushing into the floor. And then we're going to slowly roll the spine back down and the pelvis settles. We take a breath in. Breathing out, belly button, tuck, lift, nice long spine. We're squeezing those glute muscles. We're stretching those femurs across the room. We got our shoulders pushing back into the floor. We got the back of our neck pushing back just lightly, just for stability. And we have all of these parts turning on, and we're making a nice long cylinder core, right? What a great way to activate this deep core, activate the low back and the glute muscles, and create stability for ourselves, so that we have awareness and strength and we get into more function.